Watch this.
What was supposed to give Idaho parents more control has actually been too restrictive for teenagers needing basic health care or in crisis. A Burley doctor explains why. Work requirements, more paperwork, and fewer dollars. We've seen this movie before. And the sequel seems to end the same way. Fewer resources for those who need it most, at a big cost to the rest of the country. Boise has been singled out as being a so-called sanctuary city without warning or explanation. Is that even possible in the Gem State? Questions about the accuracy of this list coming from an Idaho sheriff with national standing. Well, we were supposed to hear a soundbite at this point about being a simple bill that was introduced not this past session, but the session before. It was supposed to be a simple bill, and we were told, just think about it. And many people have, and they found it's not so simple. Nearly a year after Senate Bill 1329 went into effect, that simple bill continues to get more complicated. During the 2024 session, 1329 went from introduction to the governor's office in just 3 weeks. It was meant to broaden Idaho's Parental Rights Act by preventing medical providers from performing medical procedures on kids without their parents' consent. This simple bill was called a win for Idaho parents. But now, some say the law is actually protecting the wrong people, and as Hunter Funk explains, critics say it may be doing more harm than good.
Where the real concern came was when I started to see how it affected my patients.
Dr. Benjamin Romney practices in Burley, and this law has changed, well, everything.
We realized we've got to have blanket consents on every patient that comes in that is a teenager or a minor, which introduced a lot of logistical, red tape.
Red tape that ties up doctors. If you're under 18 and you need care, even something routine, your parent has to say yes first.
Our instruction based on this law is we have to turn them away. I've never done that before.
That includes birth control, STD testing, even pregnancy care. And for some teens, asking mom or dad just isn't an option.
But there are children who do not have parents who are either able to be at every appointment or even available, period, whether they're in jail or whether they're just not responsible parents.
Romney didn't just have to imagine the consequences. He met it face to face.
Shortly after this law came into place, I had a patient come in, and my first question was, why, what took you so long to come in for your pregnancy? Realized she was 18 and that she had just turned 18. She said, well, I was told that I had to have a parent sign a document when I came in for my first appointment, so I just waited because I wasn't 18 yet and I don't have a parent available to sign that.
Lost time that matters. Prenatal care helps catch red flags, and missing it could mean the baby never gets a chance at a healthy start. Romney says providers are torn between what's legal and what's ethical.
Technically, if I do treat them, if I do let them come in just even for a pregnancy test, their parents can sue me.
SB 1329 didn't just limit care, it added teeth. Parents are allowed to sue any provider who violates their rights for civil liability, which means they can take the home, the car, and other assets, even if the doctor thought they were helping a child in crisis.
We weren't trying to cause these problems, we just want to treat our patients, and now they're making it illegal for me to treat some of my patients.
Oh, and you can't forget the impact it brings to sexual assault survivors, who have to wait for a parent to approve a rape kit.
So imagine you've got a stepfather and a mom, maybe mom's in jail or something. She's not in the picture now. Stepfather's taking care of a teenage girl, and she's being sexually assaulted by him. She can't get care unless he consents for her to get care. So how's that sexual assault going to ever be brought up with a healthcare provider? The rape evaluation that we do, he has to consent to that.
And human trafficking. Romney says he won't be able to see cases that he would have reported in the past. The only way to get care is if it's an emergency.
This is not what the Idaho legislature wanted. This was an oversight, and it just needs to be fixed.
Now, there were discussions in session this year to add exceptions, but it stalled in committee. Romney hopes this is the top of the list in the 2026 session, but he worries that there will be more teen pregnancies, undetected STDs, no justice for rape victims, fewer human trafficking cases being detected, and a major delay in care for our youth. A simple bill, obviously getting more complicated.
Yeah, and I believe this bill that they tried to fix, or this law they tried to fix last session, it did pass the Senate. It just stalled in that House Judiciary Committee.
Yes.
And so we just don't know why. It just never went anywhere from there. But
Correct.
he mentioned lawsuits. He could be sued by a parent.
Yes.
Does insurance cover stuff like
See,
this?
and that was the biggest note that he said, too. He's like, if we could get this switched, because right now they pay for malpractice insurance, which pretty much covers a lot of, care situations. This one is civil, so it means it's coming after his family's home, his family's car. So because it's different, that's the big issue, is that they're like, well, we can't. Like, we don't want to risk it. And they can sue at any point.
All right.
All it takes is once.
Sounds very familiar to other laws
Yes.
here in Idaho. All right. Thank you very much, Hunter. Any idea what it takes to build a firing squad execution chamber? You have to consider the size of the room, where the squad is going to stand, protection from bullets for staff and witnesses, and oh yeah, there's also soundproofing. Well, we now know how much all of that is going to cost Idaho to take Idaho back a few years when it comes to capital punishment. Just over $910,000. That's the new estimate from the Department of Correction to retrofit the state's current execution chamber at the maximum security prison south of Boise. And by retrofit, that means remodel the F block to handle both lethal injection and firing squad executions. Firing squad being the first option, thanks to a law that went into effect, or actually won't go into effect for another year, July of 2026, which is just fine since all of Idaho's executions have been put on hold until 2026. That's until they can finish the facility to allow for people to watch those things. And just to back it up a bit, Idaho has not had a successful execution in more than a decade. Remember, they couldn't find a vein to complete convicted serial killer Thomas Creech's death warrant last year. And lately, it's been kind of tough to find the lethal drugs to do the job. So that's why Idaho joined 4 other states to use the firing squad first, and why it's going to take another year or so and nearly $1 million to catch up. Well, Trump's domestic policy agenda and the price tag attached to it hit the United States Senate today, which means it could likely see some changes even in that GOP-controlled chamber. After it cleared the House last week, Idaho Congressman Mike Simpson sat down with Joe Paris to talk about it. Simpson said this about Medicare, Medicaid, or Social Security, quote, "No one's going to lose those things," end quote. But that prompted many of you to say some other things, like, where's the fraud and waste Simpson mentioned? Or like this one, I'd love to believe what Congressman Simpson says. However, that is not what's coming from Republicans' mouths. I've heard differently. I guess those of us who are on Social Security and Medicare will have to wait and see how they play with our money. Then my understanding is illegals don't get Social Security or Medicare because, well, they don't have Social Security numbers. That one's from Mark. Meanwhile, this one, I would urge everyone to go to the Congressional Budget Office. We talked about this last week. Read the analysis of the bill for the truthful evaluation. So this week, Joe sat down to break down what Congressman Simpson said about the bill that passed the House by just 1 vote.
If you look at the text of the One Big Beautiful Bill, you will see the word Medicaid a lot. Medicaid, 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 Medicaid.
There's been a lot of things said that just aren't true. We're not taking away people's Medicare or Medicaid or Social Security. No one's going to lose those things.
But a clear statement from Idaho Congressman Mike Simpson on what the Big Beautiful Bill will or will not do to American social programs. A statement echoed over the weekend by GOP leaders like House Speaker Mike Johnson.
And you can underscore what I'm about to tell you. There are no Medicaid cuts in the Big Beautiful Bill. We're not cutting Medicaid.
This is an extreme contrast to Democrats who say the BBB will cost millions of people on Medicaid their care. Almost a carbon copy conversation at the Idaho legislature this year during conversations about controlling state spending on the program. Like Idaho's House Bill 345, which is now law, the bill seeks to change Medicaid's programming, and that includes a requirement for 80 hours of work a month for most able-bodied adults, more frequent program eligibility checks, and a loss of federal match percentage for states paying for undocumented and other classes of immigrants' health plans.
If you're here illegally, should you be getting Medicare or Medicaid? I don't think so. So yeah, some people like that will probably lose that benefit because we will get it back to what it's originally intended to do, and that's to help those people in need.
The context of this comment led some to say that undocumented people are not getting social program benefits because they don't have a Social Security number. However, there are 14 states that use state funds to provide Medicaid or Medicaid-like care for undocumented populations, varying to some degree between those states. The bill would penalize those states, dropping the federal Medicaid expansion funding from 90% to 80% in terms of federal match, putting a financial burden on those states, forcing them to make cuts. This is a financial cut that the GOP is seeking and also could result in millions of people losing care, to the Democrats' point. Idaho, by the way, is not one of the states in that conversation. Congressman Simpson and Speaker Johnson both highlighted that nobody eligible for Medicaid loses their coverage, which is true, but Democrats argue that the work requirement and eligibility paperwork could result in people losing care, a point talked about during the Idaho session.
It puts in extensive paperwork processing and submission requirements. The upshot of that is people get sideways with the reporting requirement and they end up stripped of their Medicaid coverage.
The problem Rubel sees from there?
If we kick 25,000 people off of Medicaid who are working but just didn't properly process all their paperwork, what's going to happen to those people?
It's a contrast of a strict program and fears that this proposal could lead to a program downfall. A death by a million cut, some advocates say, that isn't explicitly written in the text.
This could actually put us in a worse position with respect to this population than we were in before we passed Medicaid expansion.
If we don't get it, if we don't get it back to its original intention, that will be the biggest threat to these programs.
So let's go back to talking about coverage for undocumented people. Our neighbors just to the south, Utah, for example, they provide medical coverage for children regardless of immigration status. They also have a trigger law in Utah that says if federal funds drop, their Medicaid expansion ends. Idaho tried to do this but did not succeed this year. So if the big beautiful bill passes, analysts like the KFF, they estimate that 78,000 or 23% of Medicaid enrollees could lose coverage in the state of Utah. So Brian, this bill would also prohibit states from establishing new provider taxes or increasing existing tax rates, and it restricts how these provider taxes, aka the states, can be used in Medicaid. And long story short, that is a way that states like Idaho talk about making their money back to help for that federal match. If the provider taxes are paused, and this is something that was talked about during the legislative session, it really hurts the income in the sense for how states pay for the Medicaid match.
Right, because I did take CK's advice and went to the Congressional Budget Office, and the thing is yeah, it's going to lower the cost of the feds, but that's going to fall on the states when it comes to Medicaid, which would be, I guess, our rainy day fund that we have in there. And the $267 billion less for SNAP, all those things are in there. And there's also that deficit that goes up to nearly $4 trillion over the next 10 years.
So it's an interesting session that's happening in the Senate right now. We'll see if the current version of the bill is what maybe makes it through.
Yeah, well, probably not. We'll see some changes, I'm sure. All right, we'll be right back. Well, that didn't last long. Last week, the Department of Homeland Security posted a list of so-called sanctuary jurisdictions meant to highlight for America which cities and counties were not cooperating or even obstructing federal enforcement of immigration laws. And it said those places would be getting a formal notification of noncompliance. Well, that list was up on the DHS website for all of 3 days. It was removed, disappeared with not nearly the fanfare as it was published, after tremendous pushback from the cities and counties on that list, and probably most importantly because of a strongly worded letter from Canyon County Sheriff Kieran Donahue. Not because the 2C carries much weight with the feds, but because Sheriff Donahue is president of the National Sheriff's Association, representing more than 3,000 elected sheriffs across the country. And that's a significant sect of like-minded law enforcement. First, the list. It was dropped on the DHS website last Thursday, May 29th. A quick scroll and you'll find Idaho, with the City of Trees as the only Gem State city listed, which prompted a Friday response from the mayor's office, saying they had yet to hear anything from Homeland Security and they weren't sure why Boise was on that list, because the city doesn't have jurisdiction over the Ada County Jail and it can only do so much with a federal issue. So the city wasn't sure how it was being uncooperative. Oh, and also, Boise is not a sanctuary city, just a welcoming one. More on that in a moment. Perhaps the response that carried a bit more weight than Boise's was from the Canyon County Sheriff Kieran Donahue, who is also the president of the National Sheriff's Association. In a letter on Saturday, Sheriff Donahue criticized the DHS list, saying it seemed to be created in a vacuum without any input. Quote, sheriffs nationwide have no way to know what they must do or not do to avoid this arbitrary label, Donahue wrote, adding, putting out this list has not only violated the core principles of trust, cooperation, and partnership with fellow law enforcement, but it also has the potential to strain the relationship between sheriffs and the White House. Sheriff Donahue went on to say, sheriffs of this country feel betrayed, and the list must be removed immediately, which it was by Sunday. Secretary Kristi Noem explained the removal this way.
Some of the cities have pushed back.
Sort of.
They think because they don't have one law or another on the books that they don't qualify, but they do qualify. They are giving sanctuary to criminals. So that list is absolutely continuing to be used, and it is going to be identifying those cities and those jurisdictions that aren't honoring law and justice.
Well, neither Secretary Noem nor that now removed list provided evidence or examples of what any of these jurisdictions might be doing to inhibit Homeland Security in enforcing our immigration laws. What we do know, this isn't the first time President Trump has tried to come after sanctuary cities or so-called sanctuary cities, but also sanctuary cities are not a thing in Idaho, because back in 2023, Idaho actually outlawed such cities. Senate Bill 1030 made it so local entities could not do anything to stop immigration enforcement, giving the Attorney General the authority to enforce that law. So Boise is not a sanctuary city, but it is a welcoming city. Has been since May of 2019, as designated by the national nonprofit Welcoming America, one of just 5 cities in the country at the time. Welcoming means Boise has committed to doing things like making sure access to community services is available to all residents.
We have the longest standing refugee organization in the country because we started it 10 years ago. Whether you're an immigrant, a refugee, or God bless you, whether you're from California, you are welcome in the city of Boise.
That was then Mayor Dave Beater during a debate with, the future mayor, Lauren McLean, who's held on to that welcoming city title. As for threatening to withhold federal funds from the cities on this list, President Trump also tried that back in 2017 when he issued a very similar executive order. San Francisco then sued, and the Ninth Circuit Court of Appeals ruled the order unconstitutional, saying that would require congressional approval. If you want to take funds away from cities, you need Congress to say okay. By the way, we did try to speak with Sheriff Donahue about his letter to DHS today, but we were told he was, quote, inundated with meetings and phone calls about this very thing, so he didn't have time today. Maybe tomorrow. You know, Idaho's home to hundreds of square miles of fresh water, and that doesn't include the hundreds of millions of acre feet under the ground. So when you turn on your faucet at home, you expect to see that fresh water come out. But that's not what has been happening in Homedale. Apparently, it's been coming out brown and yellow, stopping people from drinking or even bathing in it. That's what one mother told Aspen Shumpert, and that it's also been a problem for years.
We have been here 3 years in February.
And since moving into their home in Homedale, Amber Luton says water quality issues have persisted.
Our water is absolutely disgusting.
At least every other month, if not every month, their water is yellow.
It makes it hard for us to want to cook with it, clean with it. I don't feel like it's safe for my kids to bathe in there.
She says her family has stopped drinking the water entirely and relies on bottled water or filling up jugs at relatives' homes.
It definitely adds to the increase of our already high grocery bill. It is doable, but unfortunately it's not doable for everybody.
She says nothing ever feels clean. Not a shower, the dishes, their clothes.
You know, your water's not clean to begin with, and then you have to clean your dirty floor, and so you're just putting more dirt back on your floor.
Luton says she's called City Hall at least 4 times every year for help.
They always tell me that I just need to flush my hot water tank and that I need to let my lines run. Unfortunately, it's also my cold water, so I know it has nothing to do with my hot water tank. I asked them for how long, and they said however long it takes. I ran all of my faucets, including my indoor and my outdoor ones that are connected to my house water, for over 30 minutes. I called them back and they said, oh, okay, I guess you can turn it off because it didn't change anything.
But the discoloration earlier this week is the most severe Luton's seen it.
It did turn to a muddy, murky brown color.
When she called this week, the city sent its Public Works team out to flush the fire hydrants in Luton's subdivision.
He said that when he opened those hydrants, it was the worst that he's ever seen. If you go around to the other side of our subdivision, on the first hydrant that he opened, the concrete and the road is actually currently still stained from all the debris that was coming out of the hydrants.
She says her entire subdivision of about 40 houses all experience discolored water, but she knows of more throughout the city from posts on social media.
But it's frequent enough that it's wrong.
She hopes sounding the alarm on the issue will help find a solution.
I need them to take it seriously and for the health and the happiness of the community, and we need to know that they care about our well-being.
We weren't able to reach the city's Public Works Department today, but Idaho Department of Environmental Quality says they are aware of the concerns and have spoke with the city. They say the city of Homedale is in compliance with all health-based required water quality standards and testing. And from the pictures, DEQ says it appears to be elevated iron levels, which is not a direct health hazard. But it is frustrating. It comes with problems with taste, smell, and appearance. They recommended maybe more recurring flushing like we saw the Public Works Department come out and do today. That did clear it up. I showed you that brown water. This week it's a little more milky, not as brown.
Because that brown water is pretty brown.
Yes, so maybe reoccurring flushings, but also they tell me that the city is looking into upgrades to their system, so there could be some better improvements there down the line as
Hopefully
well.
we see that down the line. All right, thanks, Aspen. All right, Bud has a question that's been asked by a lot of people over the last few years about the Idaho legislature. Once again, legislature has shown they're not smart enough to address health care issues or protect our youth, he says. Why do they not trust our doctors? I guess they're just out here performing unnecessary procedures willy-nilly, I guess, is what they're thinking. Concerning the Social Security and in Medicare and Medicaid, when they've lied about everything else, including Project 25, says Chuck, why would we believe them on anything else? Instead of spending nearly $1 million to build a facility to put people to death, maybe we should put that money to better use, like Medicaid for those in need, says Cheryl and Star. The Trump budget is simply less for the poor, sick, and disabled Americans and more deficit spending caused by more tax cut for the richest 10% of Americans in the future. That's true. The Congressional Budget Office says those resources would decrease for those in the lowest income level, and they would go up for the highest. Meanwhile, Sarah says, sorry, your producer has a shadow from your glasses. My face looks weird on TV, apparently. Sorry about that.
Continue with us and watch free now on the KTVB Plus app everywhere you stream.